Good afternoon to everyone present here. I'll be presenting on assessment of neutrophil to lymphocyte ratio and platelet to lymphocyte ratio in patients with high myopia. Myopia is a global public health concern. The global prevalence of myopia is estimated to increase by 50% and that of high myopia by 10% in 2050. It's regulated by both genetic and environmental factors, and correlation between high myopia and inflammation has been proposed. Recently, the neutrophil to lymphocyte ratio and platelet to lymphocyte ratio have emerged as new inflammatory markers to evaluate the severity of inflammation. This study aimed to investigate the NLR and PLR in patients with high myopia and non-high myopia to determine whether they could be potential biomarkers in patients with high myopia. Methodology. It was a cross-sectional study conducted at a tertiary care center over a period of 1 year. The patients were divided into two groups. Group 1 had 50 patients who were less than 50 years of age, having myopia of -6 diopters or more, axial length of 26 millimeters or more, and not having any confounding factors that can alter the ratios, such as glaucoma, AMD, or hypertension and diabetes. Group 2 had patients which were enrolled following the same criteria but with non-high myopia and axial length of less than 26 millimeters. Each patient underwent complete ophthalmic and clinical examination. Complete blood count measurements were performed and the NLR and PLR ratios were calculated. Results. Both the groups were well cross-matched in terms of age and gender, with the mean age of being 24.24 years in group 1 and 26.49 in group 2. We also saw the relationship between the axial length and IOP of group 1 and group 2. The group 1 axial length was 27.44 and in group 2 it was 23.93. The intraocular pressures of both the groups show no significance. Comparison of laboratory parameters between both the groups. In this, the neutrophil to lymphocyte ratio was seen to be higher in the group 1, which is 2.11, and in group 2 1.40, and the platelet to lymphocyte ratio was also higher in group 1, which was 111.25, and the other group 73.75. The study revealed significant differences in NLR and PNR between the two groups. The NLR of group 1 being 2.11 with 0.27 standard deviation as compared to group 2 with 1.40 with 0.43 standard deviation, and PLR being 111.25 and 73.75 in both the groups respectively, suggesting that high myopia is correlated with systemic inflammation. Also, a positive association was found between the axial length and the ratios. Considering the impact of inflammation on myopia, more frequent ophthalmic screening, more outdoor activities and education are needed to prevent myopia in younger patients with inflammatory or immune diseases, while stronger interventions are needed in those who are already myopic. Conclusion. The neutrophil to lymphocyte ratio and platelet to lymphocyte ratio, which are indicators of systemic inflammatory properties, were significantly elevated in the high myopic group, suggesting that myopia development may be associated with systemic inflammation. Anti-inflammatory drugs and artificial exosomes may become a new option for the treatment of myopia after low-dose atropine. Thank you.
Good morning all. My paper presentation is on a novel Pythagorean based Android app construction for evaluating surgical induced astigmatism. So the primary aim of this was to design a calculator using Android Studio and study its applications in patients undergoing cataract surgery. The secondary aim is to validate the application using Bland-Altman plots and ROC curve with existing SIA calculator version 2.1. The methods involved, we collected pre and post-operative KH and KV measurements from 107 patients from ongoing dissertation project. The calculator design, the buttons and the interface was made using activity underscore main.xml, and the coding was done in Java file. An SIA magnitude was calculated by taking square root for sum of the kh square and kv square, and axis was calculated by using law of cosines, it's tan inverse function, kv by kh function. The resultant SIA vector was calculated on subtracting pre and post operative SIA vector, magnitude and axis. The results obtained, a total of 107 eyes of 107 patients recruited in this prospective study with a mean age of 62.78 years, consisting of 47.66% males and 52.34% females, with 55 right and 52 left eyes. In percentage, 51.40 and 48.60 respectively. Descriptive statistical analysis and Pearson correlation coefficients for finding association between magnitudes and axis was performed. Pair t-test was done for statistical significance. Histograms were drawn for the magnitude and axis distribution. Scatter plots were designed for finding the best fit line, and Bland-Altman difference plots were used for finding the limits of agreement between the two calculators, and area under curve was calculated on plotting receiver operating characteristic curve. All statistical analysis were performed using Google Colab Notebook. We got an SIA Android app that we made a mean magnitude of 1.31 diopters and mean axis difference of 1.52 degrees. And in SIA existing calculator, the mean magnitude we got was 1.49 diopters and mean axis 91.73 degrees. Pearson correlation revealed a positive association, that is R is equal to 0.38 for the magnitudes, while axis it showed a negative relation of minus 0.08. T-test magnitudes and axis revealed a p-value of 0.35 and 0.00 respectively. Coming to the discussion, a positive skewed distribution observed for both the calculators in magnitude, which implies a similarity in the calculations. As we can see here, a positive skewed distribution in the magnitudes. For the axis, just a symmetrical distribution noted that it implied a difference in axis calculations because of the implementation of vector-based analysis in the existing calculator, and we used tan inverse function in SIA app. A positive correlation was obtained in scatter plots between both axis and magnitude. These all are outliers, and in Bland-Altman difference plot we can see more than 95% of the data, it lies between 1.96 times the standard deviation. It implies a positive correlation, a positive good limits of agreement between the magnitudes, and the receiver operating characteristic curve, it shows a area under curve of 1 and 0.99 for our app and for SIA calculator respectively by logistic regression. So this is the user interface of the Android SIA calculator app, which has already been uploaded in Google Play Store and is readily available for the clinicians for assessing the surgical induced astigmatism instantly. And for the conclusion we drew were that our app and the SIA calculator version 2.1 both are comparable in magnitude calculations, whereas there was difference in axis calculations. Implementing the difference method of calculation, we use the tan inverse function, and in the existing calculator it's the vector based analysis. Thank you. These are my references.